Hi, everyone. Welcome back to the AVAHO Carecast, brought to you by AVAHO Voices. I'm your host and AVAHO president, Nicholas Berwick, joined by my co host and AVAHO executive director, Julie Lawson.
Hello, welcome back.
Today, we are joined by fellow AVAHO members and lead faculty for our upcoming educational event on rare and ultra rare hematologic disorders, Dr. Shruti Trehan and Dr. Christopher Fletcher. Dr. Trehan, can you talk about your current roles and responsibilities?
Sure. Thank you, Nick and Julie. I'm glad to be here today. I'm a hematology oncology physician with the Tampa VA. I'm the section chief. I also belong to the National Tele-Oncology Program with the Breast and GYN Oncology System of Excellence. I do tend to focus my practice there with breast cancer. However, see a wide variety of hematology oncology at the Tampa VA. I have been a member of AVAHO for approximately 4 years since I joined the VA and currently serve on their education committee as well as the co-chair of the Special Interest Group for Hematology Oncology. And I'm the chair of the advocacy committee for AVAHO, advocating for the rights and benefits of our veterans who are facing hematological and oncological conditions. So thank you.
Thank you. And maybe, Chris, I'll have you do the same thing.
Yeah, thanks. I'm equally excited to be here. Nice to be on this podcast with you. So I am here in Madison, Wisconsin. I'm a hematologist oncologist myself, focusing on specifically heme. So I see primarily heme malignancies, but I do manage all forms of hematology. I'm the section chief for our site. We have divided hemonc, so I'm the section chief of hematology. Um, I can't remember how many years I've been involved with AVAHO, but I've been becoming more involved in sort of the programming itself, thanks to some of your invitations. So leading the SIG group this year with Shruti. And for our site, I'm the PI for our Navigate program. That's an NCI and VA collaboration. I am the director or PI of our site's Cancer Clinical Research Network program. So we're Vision 12, at least as of now, until we move into the new system. And I also co-lead our HEMONC research program just locally. So we actually have a combined hematology, oncology, and radiation oncology program. So we pool our efforts and do our clinical research that way. And hopefully in the not too distant future, we'll be a merit awardee if all the granting process goes well. We have a collaborative multi-site trial that we're hoping to get funded. So thanks.
And thank you very much for your help in putting together upcoming seminars for us that are online in nature. I know that a lot of our members are used to us being in person, and that's usually the goal, so that we get everyone together in the same room. You can network, you can have discussions that just aren't really, they don't go the same way if we're virtual. That said, we're all busy, and travel is not always possible or easy for us to do, particularly with your professional duties. And so it is really good to have a balance of offerings that we give to our members. And so we're very excited about this upcoming webinar that we're doing in July. And with that in mind, Dr. Trehan, would you mind introducing us to who's going to be speaking on this webinar?
Certainly, it's my pleasure to let everyone know that we have an array of national speakers that specialize in rare and ultra rare hematological disorders. We'll be starting off with our talk on aplastic anemia with Dr. Emma Groar from the NIH. This is followed by a talk on acquired hemophilia by Dr. Aaron Boothby from the University of Washington Fred Hutchinson Center. And that is followed by a talk on immune-mediated thrombotic thrombocytopenic purpura, or ITTP, by Dr. Yazan Abu Ismail from the University of Utah. And last but not least will be a speech with Dr. Hani Al-Samkari on HHT, or hereditary hemorrhagic telangiectasia. And the goal with these rare disorders is to understand how to diagnose these, recognize the signs and symptoms, evaluate these patients, how to triage them for the best treatment, and create pathways that will be very helpful for our veterans as well as the clinicians that are treating them, and also serve as enduring material for reference for the future.
Thank you, Shruti. I agree with what Julie was saying earlier, where we want to see how does this work having a virtual session that's offered nationwide, where we are mirroring what we do at, say, a regional meeting where we're providing that continuing education. And we wanted to focus on rare hematologic disorders, like the ones that Shruti mentioned, because while hematologists day to day, we see a lot of common entities, whether that's blood count abnormalities, iron deficiency, but we do run across rare disorders, and because we don't see them that commonly, it's nice to hear about them. It's nice to learn about them from experts at the national level, so that way we can develop hematology expertise within our membership. The FDA defines a rare disorder as one that affects less than 200,000 individuals in the US, and ultra rare as less than 1,000 members in the US. So actually, there are disorders that fit that criteria, including the ones you mentioned, like aplastic anemia, immune TTP. Dr. Fletcher, and Shruti touched on this. I was wondering, what has been your experience with rare hematologic disorders, and how do you think hematology-focused clinical pathways could be of value to VA providers?
Yeah, that's a great question. So I've seen at least one of each of these in my career with the VA. We did have a patient with HHT, which we managed for quite a while. And particularly as I do consults, we'll get particularly acquired hemophilia. Not infrequently. I could probably still count the number of them that we've had at the VA on one hand, but they come around once every few years. And so when they do, you have to be prepared, right? These are things that require coordinated efforts. The treatments for these conditions are not usually stocked in most medical centers. And so I think, getting into the question about clinical pathways, the thing that I've really liked about the clinical pathways is that, well, one, we're getting the appropriate physicians in our groups involved nationally, but two, that they're prescriptive in a way that rather than giving a menu of options, we're balancing clinical effectiveness, cost, and those things, and directing a set of providers to give a standardized approach nationwide. And so I think that should be no different for these rare hematologic disorders. I think there's a lot of value in doing that.
I agree, and I do remember the cases when I run across an acquired hemophilia or ITTP. These are cases you tend to remember. They present very acutely, and there are decisions to be made. You need to make rapid decisions, and having VA guidance at the national level, there are more and more options for these patients. Some of them are expensive therapies. There's variability in what resources are available at individual facilities, like rapid access to plasma exchange, for example. So, maybe I'll just pivot from that topic to another topic that's near and dear to your heart, Chris. I was wondering if you could talk about your experience with AVAHO, and particularly, I know you lead the Heme Onc special interest group. If you could talk about that and what they're doing right now.
Yeah. I mean, AVAHO has been fantastic. I have to say that's a group that I found you can be as involved as you'd like to be, I guess is how I've viewed it. It's a very different style of conference because you're going there to meet with your colleagues all across the country and meet specifically on VA issues pertaining to HEMONC. And I think that it's special. It's been a great forum, and I've been pleased to become more and more involved over the years with it. I'm excited to co-lead this HEMONC SIG this year. I think we're always looking to say, like, there are a lot of amazing advances that are happening in the HEMONC space, but we're always, I think that one of the focuses for the VA, rightly so, is just on the value of the care that we're providing to veterans. And so that means, we're looking to make people live longer. And if we can't, if that can't be our main driving force, then we're certainly helping people live better. and that should be really the primary focus of cancer care in general. So I've been particularly fascinated with the space of minimal residual or measurable residual disease testing. And so this year at AVAHO, the Hemonc SIG is going to have a panel of presenters tackling MRD testing for heme and onc malignancies here in the VA. So we've got some great speakers lined up for that. And I think MRD testing, at least from a blood cancer specialist, that's where a lot of value is, because there's for some of our diseases, they're very chronic. PLL, prime example, but even myeloma. And so patients can be on therapy for very long periods of time. But it's nice if we can to treat to an endpoint where we feel comfortable stopping therapy and giving them a break, both physically and their immune systems too, for that matter. And on the flip side, some of our diseases are also dangerous, like diffuse large B cell lymphoma, and those are key areas where MRD is evolving, and it was time to sort of examine the data presented for the VA audience and take some stances on and give guidance to national hematologist oncologists on MRD testing.
Thank you for that. And Dr. Trehan, similar question for you. A lot of times in organizations, we don't think about what each other is doing. We know people, we know our colleagues, but we don't think about what goes through their mind on their day-to-day basis, what they're working on, what they're focused on. We think about our own work and what we're focused on. So if I came to you and said, what would you want people to know about your day-to-day? What would your answer be to that?
Well, you're so correct, because if you've been to one VA, you've been to one VA. That's what the running statement is. Even though we're the largest integrated healthcare system in the country, we're in silos, or we tend to be. So I would like to also echo what Chris said, that AVAHO has been truly life-changing for me as a VA hemonc clinician, that it has brought me this community and network of like-minded individuals who are facing similar, there's many good things about the VA, primarily being able to serve our veterans. That's the crux of what we do. And there's so many things that are standardized, including the pathways, but then there are so many things that tend to be somewhat different, and you don't really know about it, having come from private practice when I first came in, and I noticed all the different things that make the VA unique. But now coming to AVAHO, meeting with other people, I feel like there's a built-in support group, if you will. So what I'm interested in is trying to expand the membership of AVAHO, expand the awareness that this entity exists. And I do see in the last few years that this has already been occurring, but there's always room to grow. I do feel that clinical research is a place where AVAHO can advocate for our veterans and help get the like-minded researchers together, so that there can be a meeting of the minds, as well as I would like more advocacy efforts for certain things that the veterans have to struggle with when they're facing treatment, whether it be oncology or hematological conditions. For example, their dental care. We have to go through quite a few hoops for when they need dental clearance, and they also require approvals, etc., for certain drugs. So it would be very helpful to have a standard pathway. Also for fertility maintenance for certain young individuals, and some of these conditions occur in younger veterans. So I would, want to use that as a cause for the advocacy committee. I do think also trying to raise awareness for the veterans, where they can get specialized care for these rare conditions. Because a lot of our veterans are in the rural areas and they don't have access to tertiary care. So a lot of our rural providers and veterans do not know about the existence of NTO, and they do not know about the tumor boards. So for me, that would be a mission that I would love to advocate for. And then last but not least, I would like to find out, we have a wealth of data that we can mine. I would like to find out from our data if there is any type of connection between toxic exposures and some of these rare conditions. They're pretty low numbers in the world, but perhaps perhaps our numbers are not as low because we're dealing with so many different institutions. So we would be able to potentially look through that. And as Dr. Fletcher mentioned, our Vision 8, for as long as it is Vision 8, we also are a member of CCRN, and I'm also the Hubside PI. So this would be something good that we could do as a part of AVAHO. And I look forward to the meeting. I have not, since I joined AVAHO, I've never missed a single annual meeting. I strongly encourage my colleagues to go there. I look forward to meeting colleagues from my other VAs, and I just feel like we're at this point where it's just growing and glowing. So I'm very grateful to AVAHO for everything that they do for us and for our veterans. I think I didn't answer the question, but
You, but I love what you said. No, you did. You did. I appreciate that. I appreciate that that AVAHO is meaningful. Yes. Yes. Sorry, Dr. Fletcher.
And yeah, emphasize what Shruti is saying too. And let's not forget, there's something for everyone on the VA HEMONC team, whether that's pharmacy or nursing too. I think that's another impressive part about AVAHO is it's not just a physicians conference, but it's a multidisciplinary conference with something for everyone. And even I found it very interesting to attend some of those presentations outside of my own health profession to get the perspectives of others.
That's the point. Yes, absolutely. Dr. Trehan, you mentioned an acronym that I'm not sure all of our members would know, and that's the CCRN. Can you tell us a little bit? I know what it is, but I'd like you to share a little bit more about what that is because we're really excited about it. I think it's a really neat thing coming down the pipeline.
I will be happy to. And Dr. Fletcher has been a member for much longer than I have. But CCRN stands for Clinical Cancer Research Network. So this is the latest initiative throughout the VA where there has been a top priority from ORD to enhance awareness and also enhance clinical research for the oncology and hematology veterans, the veterans who are facing those diagnoses. Currently, it is the data is showing that veterans are not enrolling into clinical trials as much as the non VA team or community. And some of the barriers include, we do not have as many trials. Veterans may not be aware of the trials. It may take more time. It takes a longer time from the initiation, from the idea to the trial being open for enrollment. The VA has its own rules. So CCRN is a consortium of VAs that have already demonstrated enthusiasm as well as some previous research experience. And it is a grant that is being granted through ORD, which is based out of Washington, and in conjunction with the National Oncology Program, co-led by Dr. Ken Myrie and Dr. Michael Kelly. And to my understanding, currently it is being granted one per vision. So it uses a hub and spoke site model. So for example, I'll give you the example of Florida. So for Florida, we're Vision 8 and South Georgia. The hub site is located in Tampa, and we have the main site PI, which I'm honored to be, and I have a co-PI. Who's one of our junior faculty. And then our spoke sites include Gainesville, Orlando, Miami, and Bay Pine. So we have spoke site PIs. So the whole idea is we're going to have meetings both at our local level and our national level. We're going to try to strategize and enhance our clinical trial portfolio, enhance the quality of care we provide to our oncology patients, and also potentially become certified by the Commission on Cancer, which currently only one of our VAs is. And one of our other goals is to enhance our navigation services. So oncology navigation is a often underrepresented part of oncology, but it's very valuable and very important. And by joining the CCRN, we hope to increase awareness as well as fund nurse navigators and make the program more effective for our veterans as they go through the cancer journey. So that is in a nutshell what the CCRN is for us, and we're just starting. We just got granted the award a week ago, and we are here to learn from experienced colleagues like Chris.
Well, I would say you nailed it. You really captured the essence of what I understand the CCRN to be. And the thing is, cancer care is a multidisciplinary team sport. Veterans who live farther from metro areas have a harder time accessing good comprehensive cancer care. And this grant has an eye toward how are you going to reach the whole entire landmass that your vision covers, right? So for us, Madison is the hub, and our vision goes from Sault Ste. Marie at the tip of the Upper Peninsula of Michigan all the way to Danville, Illinois, which is like you can draw a line through Indianapolis and it hits Danville. That's how far our vision goes. And as the director of our CCRN group, I have to find a way to reach all of those sites in some manner of speaking so that we give veterans an opportunity to stay in the VA for their cancer care and not just stay and get okay cancer care, but stay in the VA and get top-notch cancer care. And so that creates some unique challenges. But there are other destination cancer centers in this country that people go to. And so there are other ways, there are evidence-based ways that we can do better for veterans all throughout our visits. And so as Shruti talked about, cancer nurse navigation is a big one of those. It's a very evidence way to break down barriers and reach people and get individuals who are in rural areas access to high quality cancer care. And then clinical trials also break these barriers down. They eliminate the disparities, whether you're looking at urban or rural groups that have disparities compared to the others. Those two things are pillars of how we break down these barriers and how we improve cancer care. And then the third one I think you're touching on, which is the doing the best we can as it pertains to precision oncology cancer care.
Right. And there's one other thing I'd like to add is the Close to Me program, which is another one of the VA's initiatives where it provides infusion and oncology services to rural veterans using CBOX, which is the community-based outpatient clinics. Because as Chris mentioned, most VAs serve a large area of multiple hundreds of miles, and it is not feasible sometimes for our frail older veterans who are on treatments to drive. Um, I when I was in Miami, I had veterans who lived in Key West, and that's just not possible. So the whole idea is to establish smaller satellite offshoots of the main VA, another hub and spoke, if you will, where certain infusion treatments are offered, certain oncology and hematology care lab work is offered, and that just is so convenient for our veterans. In fact, we recently reported on our experience, and they're better. They're better satisfied. They have a lower no-show rate. They like going to those CBOX. The parking is easier, and so this has been a good initiative. And I actually met with like someone from Washington yesterday, and they said thanks to the success they're seeing with the Close to Me program, they're gonna start including infusion services for any new CBOC that they are going to construct for the VAs.
Thank you both, and you both have been very involved with AVAHO, and it does just go to show, if you're a VA physician or healthcare professional that takes care of cancer patients, AVAHO is a place where you can become involved, you can have an impact, and not only involved with AVAHO, but you both are leaders at your facilities, the VA at the national level. And you really laid out a lot of these things that are really important for membership that I think will resonate with people. And Sometimes they go to the AVAHO meeting and they haven't heard of some of these initiatives. This may be the first time that folks are hearing about CCRN. So it's a great opportunity. This is just another reminder, encouragement to attend the annual meeting and having a podcast like this to get the information out there. Circling back to what you said earlier, Chris, with MRD testing, I think that's a perfect example where we can use a HemOnc-Sig advocacy committee to have a conversation about MRD testing and work with other stakeholders, lab and pathology medicine, to have these things implemented. I think of the precision oncology program and how can we utilize this or that model for precision hematology. So, for example, this session on HHT, we're going to talk about Hani Sankari is really a leader in this at Mass General, and maybe it's even underdiagnosed. I know I have patients in my panel. Are we recognizing it? Are we getting off genetic testing to confirm the diagnosis? And so I think we have plenty of other examples of that where maybe there's providers in facilities that don't see a lot of these hematologic disorders and they need to reach out to teleoncology and get information on I have a case of, I think this is porphyria, what, genetic panel testing might be helpful. So I think there is a role for that. So thank you both. Chris, touching on this, I was wondering if you could also talk a little bit more about your experience with the heme malignancy working group. You both touched on CCRN and research, but how do you think we could, come together to coordinate on clinical trials?
Yeah. Yeah, I guess I forgot to mention as one of my many hats, I've taken on the role of sort of the lead for the hematologic malignancies working group. We're primarily research focused. Daphne Friedman, I think, had inaugurated the group and was leading it for a long time, and bequeathed it to me. We've grown quite a bit over the years. I would say we're really trying to take a team approach to having investigator or stakeholder initiated research and clinical programs to tackle some of the big problems that we've got in hematology oncology today. We're trying to be, and we're not just a clinical trials working group, we're using data science as well as trying to form some sort of clinical things as well. Like an example would be implementation of bispecifics throughout the VA, or one of being its own separate work group later on. I might be the director of the group, if you will, but it's very much a service position as far as I'm concerned, where I'm trying to facilitate good ideas moving forward. And so we're working in the space of myeloproliferative neoplasms. We're always trying to do better in the myeloma space. And we even have some ideas from a CLL standpoint that have come out of this group. And the big thing is really to just keep pushing these projects forward and trying to make a difference for veterans. So this is, the thing is, all of these are different facets of a bigger program, which is the VA overall, right? And I think the big take-home point is that you can definitely achieve more by working together, right? Whether that's working together through AVAHO, working together in our own in our research work groups, working together in other programs with the VA forms like CCRN. I think that's something that's been true of the new era of the VA, and I'm very proud that it's happening, and I'm proud to be a part of it.
Thank you, Chris. Truly, I was going to ask you, about, we've mentioned AVAHO a couple of times here now, and how you think AVAHO can provide a platform for education, outreach. Where do you see AVAHO's role there?
Sure. I think our guests have done a great job of even talking about how it's affected their careers and their trajectory in terms of networking and getting different initiatives up and off the ground. I think our sweet spot really is providing opportunities, number one, to network across the VA that you don't inherently get day to day in your average work day with patients and with colleagues and with everything else that's going on. It's a very busy environment, can be definitely chaotic. And so I think we provide sort of a step back, a quiet space to go to network, to share best practices, and to think about things that you don't normally get to look up and out and think about. And so we're doing that, and that is very intentional for us. It's that multidisciplinary approach to this. But I think also we are providing an opportunity to talk about things that don't inherently happen within the system. And so, just to make it very clear, we're never working against the VA, we're just working outside of the VA. And that gives us a unique perspective and a unique opportunity. For example, with CCRM or CCRN, we have an opportunity to provide maybe a little bit of support for PIs or to supplement a project with resources that, maybe it's $50,000 that's missing from a project, but the funding isn't available within the VA. And so we have ways to do that. We have mechanisms to do that that really supplement what you're doing without having to take more time or go through more hoops and more paperwork and all of those things that are actually necessary as part of the system, but we can do outside of the system. And so it's a really exciting place to be. Dr. Trehan talked about the advocacy piece of this. And from an education and advocacy perspective, again, we are not bound by the Hatch Act. And so we can say what needs to be said on behalf of veterans and those who work with them in ways that a federal employee would not be able to do. And so I think it's a really good supplement to what's happening within the VA. Our entire goal is to support all of you who are working with veterans so that the veteran has the best experience they can have, and really to highlight what's great about the VA.
And I do have to thank AVAHO for providing this platform for hematology education. It is a way to reach membership at the national level. And we're very excited to see who's going to attend, what the interest is going to be. And, I also want to thank Taylor Cialo, Courtney LaPlante as education co-chairs who really made this happen and have other things in the pipeline, other ideas for how we want to use this platform and other platforms to disseminate education to our members. Shruti, I may have you wrap up just in terms of reminding members about the HEME session, some details on it.
Absolutely. So just to recap, we are going to have a virtual session, which is going to be on addressing rare and ultra-rare hematological diagnoses within the VA on July 18th, 2026, between 12 noon to 2:30 p.m. Eastern Standard. It is a virtual session. We welcome our membership to attend. Unlike some other meetings, you don't have to keep your camera on or participate. You can have it running in the background while you prep your dinner. And to register for it, you can go online. It is a very super simple registration. I did it myself, so I'm pretty computer illiterate. It was avaho.org. And I do believe it offers CME and CEU, and all those details are within the registration details. And I really look forward to seeing a lot of people attend, because we don't normally get access to this national level of expertise. And we do, there's been a lot of advances in these conditions. Someone like me, for example, who has to encounter them when I'm on call, but for the most part, I'm more of a solid tumor person. I'm looking forward to learning stuff and kind of getting a little better, more comfort level. So I hope there are others in my boat and would take advantage of this wonderful opportunity to learn.
And I do want to remind everyone it's free of charge because you do get CE credits. So sometimes people will say, oh, what does it cost? Nothing. We're happy to do this for free for everybody who wants to log on.
Thank you, everyone, for joining us on another episode of the AVAHO Carecast. Thank you again to our guests, Dr. Fletcher, Dr. Trehan, for joining us today. For more AVAHO content, make sure to follow us on social media at AVAHO Cares on X, avaho.cares on Instagram, and facebook.com/avaho.org. If you're interested in becoming an AVAHO member, join us on avaho.org. Thank you, everyone.